The goal of breast reconstruction is really to reshape and restore the breast as close to the original as possible. And it's important also to achieve symmetry between the breasts. Breast reconstruction can include a variety of procedures. It can be implant-based reconstruction or using the patient's own tissue. The decision is made with the patient as to which type of procedure fits them the best according to their preferences, their specific medical history, and the type of breast surgery that they require. Sometimes the mastectomy can vary between nipple-sparing mastectomy, skin-sparing mastectomy, or modified radical mastectomy, depending on the severity of the breast cancer diagnosis. Discussing breast reconstruction options at the beginning of patients' cancer treatment will help reduce any fears or concerns surrounding the breast cancer surgery. It's really important to begin discussing breast reconstruction early on in the treatment because it helps to alleviate patient anxiety. And fully exploring the options will help the patient make a more informed decision. Prior to being seen by our office, the patient is directed to our website, and this is really a way for them to review information regarding reconstructive processes as well as all of their reconstructive options. During the consultation, in addition to taking a history and performing a physical exam, we also have a detailed discussion regarding the patient's surgical options. And this is what is involved with a nipple-sparing mastectomy. The surgery is usually done with an incision under the breast, and then the surgeon comes in and separates this tissue from the overlying fatty tissue so that essentially we've removed all of the breast tissue and now we have to do our reconstruction. So an implant does not require any tissue from anywhere else in your body to be used. And so the way that we do the reconstruction is we rebuild the breast pocket by using a collagen matrix, which is there to sort of hold the implant and provide long-term support. And so we're actually able to do this sometimes direct to implant, meaning that right away after the mastectomy, we place the collagen and then we place the implant directly under the mastectomy skin, so that this is an outpatient procedure and you get to have a breast reconstruction all in one day. And so some patients don't really want any prosthetic or foreign body in their body for other reasons. And so they would like to see if there are options that just use their own tissue. And oftentimes we have excess tissue in the tummy, and that allows us to use that for reconstruction. After the first consultation, the patient is seen for a second consultation, and this really is to finalize the surgical plan and answer any remaining questions that the patient may have, as well as time to review all of the information that was presented during the first visit. For the patient's convenience, they're given the options for this second visit to be completed virtually or in person. Informing the patient about breast reconstruction is very important to allow patients to make the best informed decisions for them. Breast reconstruction can be a quite complex process, so it's important for patients to be given a lot of information about this in different formats, whether it's web or video or personal consultation. So they are really given a wide array of information about very specific procedures so that they can go ahead and make the best informed decision for them. As a breast reconstruction surgeon and a woman, I understand that a diagnosis of breast cancer can be very overwhelming for patients, and the choices for reconstruction can add to the patient's uncertainty. Patients put their trust in me, and my goal is to provide them with the most advanced state-of-the-art breast reconstruction options in a very caring and supportive environment so they can successfully rehabilitate from their breast cancer or other breast-related problems and regain their femininity in a way that enhances positive physical and mental vitality.